सामने ही रख देते हैं इसको। तीन सेट की सेट ये तो मुझे का दिखाना होता है तो ये 2 3 ही दबा सकते हैं। तो ये आप भी देखो, बाकी ये एक पे रखना आपको बेहतर।
क्यों बैठा हूँ बनाओ तो इसको
वैसे तो कोई है नहीं ऐसा, तो आप मुझे वीडियो कॉल पे कर दे, सेट कर देंगे।
यानी वो हेयर केयर और नेल केयर का सामान,
मुझे सामान दे दो थोड़ा बहुत, हेयर केयर नेल केयर तो क्या क्या चाहिए।
ज्यादा दम बाबू के माने देख लो।
अब ये वहाँ लाइव आ रहा है, वहाँ पे लगा सकते हैं ना टीवी पे।
कौन सा
बाहर टीवी पे भी लगा सकते हैं यहाँ का लाइव।
ये उसमें
लगा तो
हाँ लगा यूट्यूब पे है ना।
हाँ यूट्यूब पे आएगा ना। वो मैकिंटॉश शीट भी होगा ना।
मैकिंटॉश भी मांगे क्या तो मैं कर लूँगा सामान है ना जो कितना रखे मुझे कई लिस्ट है सामान आर्टिकल रिक्वायर्ड 2 कितना क्या मांगे बस करते भी नेल किया
राजा किधर है?
अरे सर बैठ
अभी थोड़ी देर में एसी के किधर है रिमोट? जी एसी दो
ठंडा है ना मौसम
ना
कौन कैसे काम चलेगा वैसे
एक चला दीजिए रोटेशन हो जाएगा
एक फैन होगा
और एक पंखा भी चला हल्की स्पीड पे रहते साउंड नहीं कर रहे एक एसी चला दीजिए जिससे थोड़ा सा सर्कुलेशन
एक बार दोनों चला
थोड़ा सा औसम
ज्यादा नहीं है तो
27-28 पे दोनों ही चला दीजिए इससे रोटेशन होता
किसी में नहीं है वो भी चीजें कुछ मुझे कंप्यूटर उनका भी तो है
हाँ
वहाँ देखते हैं पार्टी और पे
सोशल मीडिया देखते हैं जाते
हेलो सर नमस्कार
बस
यस सर
वर्तमान मालिया
अरे बॉस का काम अभी मैं किसका बने
हो गया इसमें उसने भेज दिया था
तैयारी है
रेडी
बस पूरी ऑडियंस
हेलो सर
सत्यनारायण जी और हरी सिंह
हाँ एक बार देखें इसको कैसे
नमस्ते भाभी
वो
इधर रिक्वेस्ट
यहाँ पर पानी की बॉटल्स आ रही नॉर्मल पानी का पी रखिए हाँ नहीं एक परी मेडिसिन का होता है
मेडिसिन
और एक है ना आप बाथरूम कर लें
कोर्स
मैं चाह रहा था कि अभी तो जैसे हमने कर लिया, दो हम लोग मेडिसिन की हैं, नेक्स्ट टाइम मेरा ये एक मेडिसिन से और एक सर्जरी से होता है, तो प्रेजेंटेशन
हाँ।
नेक्स्ट उसके बाद ऑर्थोपेडिक्स होता है, इस
बिल्कुल,
तरह से
तो
बेसिकली
rotation से होता है।
सारी स्टेम्स जो है वो एक ही प्लेटफॉर्म पे चलती रहे और कॉमन टॉपिक पे डिस्कस करें, बेसिक थीम पे दे जाएंगे। और ये लॉन्ग टाइम से अवेटेड कंपनी का तो एक ऑलटुगेदर डिफरेंट है, दिस इज अ नॉन वो कंपनी स्पॉन्सर एकेडमिक
इसमें भी अपन जैसे कर सकते थे, जैसे डायबिटीज को ले लिया, डायबिटीज ये फॉर्मल
YouTube पे लाइव है, लाइव हो गया
तो उसमें आप सर्जन का
मेरे को ध्यान रखने वाली बात है, YouTube पे लाइव
इस पे अगर आप देख सकते हो चालू है।
मतलब बात कुछ भी करनी हो तो क्या लाइव
कर दिया मैंने।
सर कैसा
बहुत बढ़िया।
आराम से नहीं बस
कुछ है अंदर बहुत
आपकी
काफी सुंदर
क्यों मैंने मेरा 3 साल हो गया, आप मेरे से 6 साल हो गए।
सर नमस्कार।
हाँ आज मैं फोन कर दिया तो मॉडल है।
हेलो सर। हाँ वो तो हमारे 3-4 साल मेडिसिन यहीं से किए थे आप।
सबसे पहले आपकी वाली है
बस
वो हो जाए इसको ना आप यहीं खड़े हो ठीक, फिर भी अगर आपको लगेगा तो रिमोट से भी आप कर सकते हैं, बट उसमें थोड़ा सा क्लिक रहता है। यहाँ आपको पता है आप बात कर सकते हैं पीछे
हमारे अभी से देखते हैं
क्या कह रहे हैं बॉस?
ठीक है, अभी से देखते हैं
ना नहीं दे
पूरे एडवांस सिस्टम के साथ एक बिल्ड
एडवांस सिस्टम वहाँ पे भी
अभी अपना वीडियो देख लेना यूट्यूब पे सीधा हो रहा है और उस वाले टीम पे उसके थ्रू वहाँ डाउन तो ये अपन वहाँ देख लें। अच्छा यूट्यूब पे भी
बेसिक ये तो मतलब कि एकेडमिक स्टार्ट कर रहे हैं, फर्स्ट है उसमें डिफरेंट जो ब्रांचेस है तो सबका प्रेजेंटेशन रिप्रेजेंटेशन है, मेडिसिन सर्जरी सेकेंड ये की नॉन This is all to do with our doctors and doctors. Without any contribution and this is hello. How was hello? How was pumpkin? अभी आपका पहली बार हाँ देख कर रहे
Take first.
आपको मुझे आपने हाँ सेशन शुरू हो गया
उसी में नया क्या हो रहा है
रोबोट आने तो 2 साल पहले ही था,
अच्छा
पर वो कोड चला गई दूसरी कंपनी। अब वो कोड ने स्टे दे रखा है, स्टे करके घर में जैसे हाईवे पड़े हैं अशोक जी के टाइम पे बॉडी
क्या
वो कर दिया, पर वो कंपनी मान नहीं, वो इंडियन में उसका तो कैसे बिल्कुल ही वही उससे बनता अच्छा नहीं आएगा, आपके भी कोई करना नहीं होता है कि ये क्या लेंगे, वो क्या है वो पकड़ लिया है इंडियन में, इंडियन में को तरजीह नहीं दे रहे उसके
मुझे भी कोरोना में ऐसा सुना कि
लिए वही सेम मार्केट में देखिए लोग उसको लेने से पहले तो अपने को उसको जो फ्री होते हैं तो बेटर है, तो कोई गवर्नमेंट सेटअप में कोई आदमी नहीं लगा हुआ था, पहला मंदिर बन के था, जो भी गवर्नमेंट सेटअप में लगा वो वही लगा हुआ जिसको ले रहे थे। और मुझे डिसीजन कभी लिस्टेड नहीं हो
और से दूसरा कोई एक जो टेक्निकल टीम है वो लोग बेसिकली फेस करते हैं, तो उनका क्या है आदमी तो गरीब नहीं होते हैं, वो कहते हैं सर वो चलो ठीक है या चार भी हो जाए थोड़ा सा क्या करें नहीं जा रहा यहाँ तो फिर फिक्स हो गए कोर्ट में ये जैसे मेडिकल सर्टिफिकेट दे विल डिसाइड कोर्ट नेग्लिजेंस वाले
कोर्ट में सर अशोक जी के टाइम जो एज थे उसको समझाया, फिर उसके बाद बंगाल की सरकार ने एज को समझाया, फिर उसका चेंज मेडिकल का चेंज हुआ उसको समझाया, फिर अब वापस एक कोई राज नहीं चाहिए, अब उसको एक दिन समझा दिया, अभी तक तो होटलों को समझा रहे हैं, अभी तक तो बारी नहीं है,
तो हमें मजे लेते
तो वो लिस्ट नहीं
हैं जब आप बगल शुरू करोगे तो वो स्टडी कर चुके होंगे क्या क्या अपना बिजनेस ढूंढ रहे हैं
वो उनको कुछ पता ही नहीं, वो कह रहा मैं जाके खड़ा हुआ देखकर बताओ सही है क्या रामायण क्या है, उसको पूरे रामायण समझा
मैं वही कह रहा हूँ ना वो अपना काम सीख लेने से पहले समझ लेंगे कि हम क्या करना है।
हाँ जी
सर
यस सर
वेलकम
मेरे को लग रहा है चेयरपर्सन जी सबसे पहले आए हैं
सर नमस्कार।
सुनने वाले कमेंट आप बोल रहे हैं
सर
आप जल्दी प्रिंसिपल सुनने वाले
लाइव हो चुका है
कैसे
लाइव हो चुका है कैमरा ऑन वगैरह सब यूट्यूब पे लाइव है, अगर आवाज पकड़ता है तो उसको लिंक कराऊं
ऐसे भी नहीं करते
ठीक
छोटा मोटा भी
मुश्किल
अच्छा हाँ 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 56 अब 6
मैडम है 68
हाँ मैं ठीक
ये भी फ्यूचर बताइए ये बैठना ये तो इसको तो देख तो सारे वाले वालों को जो 57 से नीचे ये सब कुछ वो सब पहली बार वो सब पहली 3 महीने हाँ एक बार
3 महीने म्यूजिक
कुछ ये क्या चीज है पहली बार ये तो आपको क्या लग रहा है कौन सा उसको नहीं आई नो से डायलिसिस मैं नीचे तो सारा आईडी
नमस्कार
हाँ
परमेश्वर सर गणपति जी और हम लोग
ये
What reminds me नीचे साधन का सर आई Hello.
Good afternoon. Today we gather here to celebrate World Diabetes Day, and for this I will invite Dr. Ajit Kothari sir as a chairperson. Please. Now I will invite Dr. Arun Vaishya sir. And Dr. Ganpat Chaudhary as a chairperson. I also invite Dr. Mahendra Singh. Please come forward and have a seat. This is IMA first academic update meeting, and we will continue this meeting for a longer time. I wish it will be continued with support of all of you. basic theme for this academic update. We take different streams in academic update like surgery, medicine, orthopedics all together on a same platform, and we'll discuss the common problems and also the update from other field. So the basic aim is to improve ourselves, and this is a non-commercial academic update. No company will involve in this meeting. All the doctors, we are on same platform, and on different fraternity will discuss the different aspect of medicines and other fraternities. So today I will be the first speaker, and before this I will give thanks to Kerasa Society and Mr. Harish Agarwal is academic coordination is academically coordinate this academic update. So I also call him. Please come on that.
Thanks everybody for coming to this place and honoring us. This is a Care Asha Society founded by the Dr. Arvind Mathur sir, and he has offered us to use this facility for academic purposes. It is free of charge and non-profit activity. And Dr. Siddharth, other than few more agencies, are using it on a monthly basis. पहली बार तो हम लोग एपीआई के फॉर्म पे डायबिटीज और उस पे रखा है, बट आप दो स्पेशलिटी के लोग और साथ में अजीत कोठारी सर भी हैं, तो इसमें आप कभी मेडिसिन का एक टॉपिक हो जाए, कभी ऑर्थोपेडिक, सर्जरी, गायनी का एक टॉपिक होता रहे, तो इस तरह से आईएमए के जो मेंबर्स हैं जो सभी ब्रांच से हैं, सभी स्पेशलिटी से, दे ऑल विल बी बेनिफिटेड. तो ऐसा कुछ आप लोग आगे ऑफर कर सकते हैं. नॉट टेकिंग मच टाइम, ऑलरेडी डिलेड. फर्स्ट लेक्चर इज फ्रॉम डॉक्टर सिद्धार्थ.
Good afternoon again. As we all know, today is the World Diabetes Day, 14th November 2025. We are celebrating the birthday of Frederick Banting on this day, and WHO Day is World Diabetes. WHO has decided to celebrate this World Diabetes Day on 14th November every year to raise the awareness and about the diabetes and prevention. This year, the theme of diabetes is that the diabetes can affect every stages of life. So the diabetes can impact people across all life stages, including childhood, reproductive years, and working age and older adulthood. The theme of year WHO say that we will discuss more on diabetes across life stages. So to recognize that every person living with diabetes should have access to integrated care, supportive environment, and policies that promote health, dignity, and self-management. As you see that the blue color circle for diabetes, this is the diabetes awareness circle. It includes diabetes prevention and care efforts must be integrated across life stages, and supporting well-being and self-care empowers the people with diabetes at every age. World Diabetes Day provide an opportunity to raise awareness about diabetes as a critical global public health issue. Why this diabetes is critical? Because in world every 5 seconds one person is dying because of the complications of diabetes. So it's a really a serious disease which we have to unite and fight against this disease. Join us in raising awareness, spreading knowledge, and creating lasting changes for all the affected by diabetes. Is that India is diabetes capital of world? Yes. After the China, the number of diabetic patients are more in India, and approximately more than 10 crore people in India are affected with diabetes. And out of this, less than 50% are diagnosed diabetes. More than that are still having diabetes, but they are not diagnosed. Besides this, 136 million are pre-diabetic, in which diabetes is running, but they don't aware of diabetes. So The total cases are approximately 101 million in India have diabetes according to ICMR and India Diabetes Study. Prevalence globally, all over the world, the prevalence of diabetes is 10.5%. Pre-diabetic, as I told, is around 136 million, and the growth trend, you see that in year of 2000 there are 32 million of diabetic patients, which in 2021 become 74 million, and now 101 million recently. So how much fast growth of diabetes is going on? So to overcome this, globally, WHO decided that the global diabetes coverage target are 80% of diabetes should be diagnosed, which is presently is only 50%. Then 80% of people with diagnosed diabetes have good control of glycemia. 80% of people with diagnosed diabetes have good control of blood pressure. 60% of the patient of diabetic over the 48 years should be receive statin therapy, and 100% of the people for type 1 diabetes have access to affordable insulin and blood sugar glucose self monitoring. Then how you diagnose the pre-diabetic patient? For a diabetic patient in whom you will screen having family history of diabetes, obese or overweight persons, then history of hypertension, history of dyslipidemia, sedentary physical activity, and history of gestational diabetes, history of CVD, and history of polycystic ovarian syndrome. For all you know, detection of pre-diabetes, you should give OCTT, and the fasting plasma sugar should be 90 to 1 hour plus 1 hour sugar level should be 180, and more than 2 hours it should be 150. This is the cutoff point. As you already everyone know what are the diagnostic criteria, but I am revised just for a brief. Fasting blood sugar should be more than 126 milligram per deciliter. 2 hours postprandial sugar would be more than 200 milligram per deciliter, and HB1AC level should be more than 6.5%. Symptoms of diabetes, common symptoms are polydysphia, polyphagia, polyuria, weight loss, tiredness, weakness, generalized pruritus, recurrent urinary tract infection, delayed healing of wound. This was all very brief for diabetes. Now I will start my topic, which is managing diabetes across the life stages. This is the theme of this diabetic celebration. Management of diabetes in different stages, I will describe briefly. There are 5 stages. First, we will consider children between the age of 0 to 18 years, then young adults between 18 to 40 years, in between 40 to 65 adult group, separately pregnancy and seniors group. While treating children and adolescents which are below 18 years, our focus should be on the growth, education, and also their family involvement should be there, so the blood sugar can be controlled better in children. Lifestyle balance meal is required, and child is allowed to play more than 60 minutes per day and reduce the screening time. As you know, children are only treated with insulin therapy either by pumps or injection, and their diet should be managed according to carbohydrate calculation. The challenges while we are treating children is their school routine is important, so we can decide whenever at which time we have to give insulin, and in school what they have to do. Puberty fluctuation is also challenging in children and adolescents. Besides this, the children should be treated and educated for diabetes and encouraged independently gradually. By treating adult, we have to focus on the self-management as they can understand diabetes better than children, and special planning for their work and travel, because at this age the people is frequently migrating and also going to work. So at what time they should take insulin injection or diet, they should be educated. Then lifestyle management is also important. Healthy eating, exercise at least 30 minutes every day or 150 minutes a week is necessary to prevent diabetes or control of diabetes. And stress management is also important, as stress increases cortisol hormones and also increases blood sugar level. So it's difficult to treat if patient is having stress and we start treatment, but patient is not controlled because of stress. How will treat in this age group? We can use insulin, oral medicines, and GLP-1 agonists. Challenges are when they go for work or school, and social pressure is also there. Continuous glucose monitoring by CGM is required nowadays. Then in adult age group of 40 to 65, the focus is mainly prevention of complication of diabetes. This is important, like blood pressure, cholesterol, kidney, all are damaged by diabetes. Lifestyle modification is also important. Mediterranean diet include the plant diet using whole grains, legumes, and virgin olive oil, less fatty food, and muscle training is also important, as there is sarcopenia of muscles who are affected by diabetes. Treatment require metformin, oral hypoglycemic agent, SGLT2, and insulin. Challenges are work stress, especially focus on menopause or andropause age group, and regular checkup is required, especially for eyes, feet, and kidney. During pregnancy, maternal and fetal monitoring is important. Lifestyle changes like prenatal nutrition and moderate exercise should be allowed for controlling diabetes. Treatment, only the insulin is preferred, but nowadays metformin can be given. Challenges are especially for gestational diabetes, and tip is plan for preconception care. For senior, the safety is important and symptom management is important while treating a senior diabetic patient. In lifestyle modification, gentle activity is required and balanced meal should be encouraged. Treatment requires simplified regimen, and chances of hypoglycemia are more in elderly patients, so it should be taken precautiously. Challenges are polypharmacy, as there are other diseases like cardiac and other problems like kidney problems is there. So number of drugs are more. So you have to keep in mind while prescribing an anti-diabetic medicines in elderly people. Besides this, cognitive issue is also there. Many times patients forget to take pills or insulin, but and this can be corrected by giving caregiver support so they can remember their treatment. Now we will take some more description in adult age group, age of 40 to 65 years, how we can treat. The key challenges by treating adult persons are, as we know, diabetes affect every system of the body. So after so many years of diabetes, the kidney, eye, heart, all will be affected, giving rise to hypertension, obesity, and heart diseases. Stress is also important. Stress from work, family, financial pressure is important while treating diabetic patients. As you know, as the age is increasing, metabolism is decreased, and there is muscle mass loss and sarcopenia is there. Medication adherence is also difficult because of busy schedule in their work. Complication risks are more like neuropathy, retinopathy, kidney diseases, etc. Management strategy, how we can manage is lifestyle modification, diet, exercise, sleep and stress, medication, oral medication, injectable medication. The goal of treating diabetic patient in adult is keep the sugar level below keep the sugar level in the range of 80 to 130 and postparental less than 180. HB1AC level should be less than 7. Screening of annual eye, food, kidney is required, and prevent complication is also important part while managing adult diabetic patients. Nowadays, ADA guideline, how we treat adult patient is important for all of us. So, in very simplified manner, nowadays we treat the patient according to HB1C level. So, if the HB1C level is less than 7, then only modification is required, no treatment required. If blood sugar is not controlled by lifestyle modification alone, then we will start monotherapy. And when we treat monotherapy, when there is HB1C level between 7 to 8.5, if still the sugar is not controlled, then the dual therapy we include. And lastly, if patients come directly with more than 10 HB1C, then we can start insulin or insulin plus oral reagent. As you know, anti-diabetic drugs available nowadays are to treat diabetes mellitus stage first and second are insulin and oral hypoglycemic agent. I am just briefly summarizing them. Insulin are four types: rapid acting, short acting, intermediate, and long acting. Rapid acting are the rapid acting are aspartame, glucosamine. Short acting are regular insulin, intermediate NPH insulin. Long acting are datrimar and glargine. Oral hypoglycemic agent, as you know, biguanide series include metformin, sulfonylurea, glibenclamide, gliclazide. Megalinides are netaglinide, DPP4 inhibitors. All gliptins, telanagliptins, sitagliptins, GLP-1 agonists, SGLT2 inhibitors are canagliflozin, dapagliflozin, acarbose, voclibose, thiazolidine, S-pioglitazone, and amylin analogs. So, as all the physicians know how to start medicines in diabetic patient, but for other branches, how we will start anti-diabetes agent in type 2 diabetic patient. This we will take in descriptive form. When, as I previously told, when there is HB1AC is 7 or below 7, no oral medication required. After this, 7 to 8.5, we start metformin first. The drug of choice is first metformin. We will start metformin 500 milligram. I used to prefer give after food because when I am starting first time, because of GI intolerance is more. So if I start medicine and patient is denied to medicine because of GI intolerance, so he will discontinue. So I am prescribing metformin 500 milligram after food. Then, if the sugar is not controlled, then titrate the dose accordingly. 500 milligram twice a day, or 500 milligram or 1000 milligram maximum. I will give 2000 milligram per day. If the sugar is not controlled with monotherapy, then we can add second drug, either sulfonylurea or SGLT2. We can add metformin and sulfonylurea like gliclazide, glibenclamide, and glipizide. We can add for gliclazide initial. We will start 30 milligram dose and can titrate up to 120 milligrams per day. Likewise, metformin with glimepiride, we will start glimepiride in dose of 0.5 to 1 milligram and can titrate up to 4 milligram once a day with 1000 milligram twice a day metformin. When the HB1AC level is between 8.5 to 10 milligram, we can also use SGLT2 like dapagliflozin or empagliflozin. Dapagliflozin we start with dose of 5 milligram and gradually increase up to 10 milligram along with metformin up to 1000 milligram twice a day. When the HB1AC level is more than 10, either we can start insulin or with triple therapy, maximum dose of metformin with SGLT2 or sulfonylurea, DPP4 or pioglitazone. If obesity is concerned, nowadays we choose oral drug is available, semaglutide. Oral dose is 3 milligram, which can increase up to 7 to 14 milligram depending on the patient tolerance. If post-parental hyperglycemia is more after taking meal, the blood sugar peak level is high, then we can add acarbose or ripaglinite. As we are living in India where finance is a problem, we are maximum time using metformin, sulfonylurea and pioglitazone. It also gives a better result. In this table, all the oral hypoglycemic with their side effect, with their benefit, and with their side effects are explained. Sulfonylurea are inexpensive, but they cause more hypoglycemia and weight gain. DPP4 inhibitors having low risk of hypoglycemia, but they are expensive. Likewise, SGLT2 are having low risk of hypoglycemia and reduces body weight, but they are expensive. And chances of UTI is more. Like thiazolidine, a low risk of hypoglycemia, but weight gain and fluid overload is there, so they should be avoided in case of congestive heart failure. Acarbose having low risk of hypoglycemia but having more side effects. Glinides have parental sugar glucose. They cause less hypoglycemia, but they are less potent and more expensive. Likewise, GLP-1 receptors are low risk of hypoglycemia and weight loss. Lastly, the treatment algorithm, I already told you, monotherapy, dual therapy and triple therapy. And if it is not controlled by triple therapy, we can add insulin. Insulin initially started as a basal insulin. Then if it is not controlled, bolus insulin is also given, or basal insulin plus oral hypoglycemic agent can be added. Thank you. We have to come under one umbrella to fight diabetes. Now I am inviting Dr. Mender Singh, he is endocrinologist with us. Beside this,
Chairperson.
Yeah.
Now stage is with the chairpersons for asking the questions.
I think okay, we will continue. Okay. Yes, sir.
The role of chairperson is not to ask questions. First of all, let me congratulate Dr. Siddharth Rajwada for starting this wonderful program. And very truly, the diabetes is one subject which should not be restricted to physicians or endocrinologists. It is involving every part of the body, and likewise, every specialty is involved, whether it is eye or it is diabetic foot surgeons or orthopedicians. Every specialty is involved in gestational diabetes and eye. So the basic fundamental knowledge as well as the regular updating is essential for all these specialties. And I think you have very rightly chosen the subject to begin with this. Regarding diabetes, we have already spoken World Diabetes Day. We have attributed this day especially to make a global awareness for diabetes. And it becomes of more importance for Indian doctors as the magnitude of problem is greatest in our country. It is not only creating a health burden, but creating also a social and lot of financial burden. So I think every one of us have to be very careful regarding the awareness, the spreading awareness of diabetes and its treatment and complications, so as to improve the quality of life, at least if we cannot cure. Dr. Mahendra Singh, I think, will throw light, but the program of diabetes reversion is nowadays very popular, at least in metropolitan cities, where people have started reversing diabetes with the help of uh, lifestyle modification and this awareness only. Without drugs, they are maintaining good HbA1c. So with this background, I invite Dr. Mahendra Singh.
Before this, you want to take after this? Okay. So please, Dr. Mahendra Singh, come on dais.
Third one. With
Yes. Thank you all of you for inviting me as an IMA Society and ASA Society. I'm thankful for Dr. Siddharth Bose for inviting me and maybe the first interaction within the IMA Society. Basically, as Bose mentioned, the motive of this academic feast is we should be like 10, 15 doctors, 20 doctors regarding the awareness. Sometimes, as Sir told, there was some difference between the different specialties. Some regarding the management of diabetics, sometimes surgeon has a problem, some as orthopedician has a problem. So, as Sir told, the diabetes is a global problem. It's the patient is coming, he has some orthopedic problem, surgical problems, some gynae problems, or diabetic. And sometimes what happens, what we basically read is the HbA1c should be this, sugar should be this. We neglected as a patient or whole. It should be treated as a whole patient. And not only the medicine part, but a good feeling from the patient is also assisted. So their motive is very good. Sometimes the whole faculty of medicines, medical field should come, and then we have some concern, our own concern, like I, as an endocrinologist, what I concern, as a surgeon, what is I'm going to concern. Some point I will discuss later on. Thank for Dr. Siddharth and Dr. Agarwal, Harish Agarwal Bose for inviting me. So this year themes was basically, it is a well-being. So diabetes and well-being. What do you mean by well-being? As I told you, now as a physician and as an endocrinologist, we are only concerned HbA1c कितना है, fasting कितना है, PP कितना है, हमको इसका complication. We forget about the well-being of the patients. So well-being at our clinic and well-being at a home, and now the motive of ADA is well-being at places like patient where is working, because out of 10, 7% who are suffering from diabetes is in working groups. So we required a good environmental of feeling well at where the person is working. Secondly, the another concept is out of 4, 3% of diabetes is diabetes burnout. लंबे समय से बीमारी है, बहुत समय से चल रहा है, क्या करेंगे, HbA1c, डाइट, एक्सरसाइज, फटिक हो जाता है सब कुछ. तो हम एक ऐसा एनवायरमेंटल प्लेस पे भी प्रोवाइड करें. बेसिकली हम तो वर्किंग फोर्स है, बेसिकली जो भी ये है इम्प्लीकेटेड है एक ब्यूरोक्रेट लेवल पे, एक सोसाइटी के लेवल पे, कि कैसे हम एक एनवायरमेंटल डायबिटिक एनवायरमेंटल एक प्रोवाइड करें. बेसिकली जो लोग वहाँ काम करते हैं, छोटी छोटी चीजें जैसे फिजिकल एक्टिविटी, कुछ ऐसे ग्रुप है जहाँ सुबह 8 बजे से लेकर 10 बजे तक पेशेंट काम कर रहा है, कहाँ वर्क करेगा, कुछ ऐसी फैसिलिटीज हो, डाइट की फैसिलिटीज हो, कुछ ऐसे आजकल जैसे आप IIT सेक्टर में अपन देखते हैं जो हमारे यंग जनरेशन, बिकॉज डायबिटीज इज वेरी कॉमन नाउ, जो हम
जो टाइप 2 डायबिटीज हम पहले 40-50 साल की उम्र में देखते थे, अब 20-30 साल की उम्र में मिल रही है, तो उन लोगों के लिए कैसे मैनेज करें। एंड सेकेंडली, जैसे डायबिटीज यंग जनरेशन में आ रहा है, नेचुरली है कि कॉम्प्लिकेशंस बढ़ेंगे। इफ दे लिव लॉन्गर, दे हैव द कॉम्प्लिकेशन। एज जस्ट नाउ, राइट नाउ, हरीश बॉस ने मुझे बोला जीरेटिक पॉपुलेशन इंडिया में बढ़ने वाली है। बिल्कुल राइट। तो जीरेटिक पॉपुलेशन जितनी बढ़ेगी, कॉम्प्लिकेशन बढ़ेंगी। तो मोटिव यही है कि कॉम्प्लिकेशंस को रोका जाए, साथ में वेल बीइंग एक कंसेप्ट डाला जाए। सो इसको देखते हुए अगले 3 साल तक जो एडी है उसको एक कंसेप्ट को पूरे वर्ल्ड में एक इसको कंसेप्ट को पॉपुलराइज कर रहा है कि वेल बीइंग आल्सो फैक्टर, ताकि वो कॉम्प्लिकेशंस भी रोक सके और पेशेंट भी बेटर फील कर सके। सो ऑलरेडी बॉस ने सब हमको नंबर ऑफ पेशेंट्स कितने वर्ल्ड में प्रेवलेंस की कैपिटल है वो सब हमको बताएं। अच्छा, डायबिटीज वेल बीइंग मींस not only the medicine I told you, it is a mental and social well-being. So this all component should be taken care, and basically एक और जैसे अभी तक सर भी जानते हैं कि हम बोलते हैं ABC ऑफ डायबिटीज कंट्रोल। तो उसमें HB1C, A for HB1C, B for blood pressure, and C for cholesterol. Now there is a 4 target. Maybe in few years in textbook we come up to the 4 target. Basically इन 3 टारगेट को हम बोले तो यूग्लाइसिमिक, यूलिपिडीमिया, नॉर्मोटेंसिव, लेकिन एक 4 टारगेट और होना चाहिए, and mostly most of the society is trying from, that is euthymia. It is a stable mood, a feeling of good, which implicated all these 3 target to be achieved. So एक mental strongness patient की, क्योंकि chronic diseases, that is should must. So this was the background, और इसके background के पीछे reason है happy hormones. Basically, if you are having bad feeling, you has a good feeling, your body produces